Hello, let's talk about ectopic pregnancy. Some people is asking what's ectopic pregnancy, what's the cause. Ectopic pregnancy simply means development of a fertilized egg outside the uterus, which mostly is in the fallopian tube because that is where fertilization takes place. But it can also occur in the abdominal cavity, in the ovary, which is very rare. So, after ejaculation, the spermatozoa swims up to the fallopian tube where the egg is, and the first one to reach there fertilizes the egg, yes, in the ample of the fallopian tube. So when it's fertilized, this egg travels down to the uterus for implantation to take place, and it takes about 3 to 4 days for this to happen. But when the fertilized egg cannot travel successfully down to the uterus, it implants in the fallopian tube and starts developing. That's what is called ectopic pregnancy. Yes, there are the symptoms of this ectopic pregnancy. It's normal as normal pregnancy symptoms. Yes, but some people might experience vaginal bleeding in that first trimester. That's where everything occurs. So, how do you know that you have ectopic pregnancy? It is when you go for medical checkup. That is why when you are pregnant, you go to the hospital for checkup. You go for ultrasound. So that is how to know. Ultrasound, that's where how you can know. You cannot just know like that. So if you are the one that do have vaginal bleeding, which is very abnormal in the first trimester, your healthcare provider will diagnose you based on the symptoms, based on what you complain to him or her. So how is this thing solved? When ectopic pregnancy is noticed at the early stage before rapture takes place, you can be given the healthcare provider, they will give you a medication known as methotrexate. So this medication helps to stop the development of the fetus, that's the fertilized egg, to stop the multiplication and the development, and gradually the pregnancy is terminated. And this requires continuous monitoring so that you know whether you need the second dose, because some people after the first dose it will not be a success, so they need the second dose. But in a case where the tube has been ruptured, that's when it is not noticed on time. It is corrected through surgery. It's either they remove the affected fallopian tube and the fetus and the embryo, or they open the fallopian tube and remove the embryo, just like that. So, who are who are the people at risk of this ectopic pregnancy? First is if you had it before, you are at risk of ectopic pregnancy. If you have endometriosis, people with pelvic inflammatory diseases, that's sexually transmitted diseases that causes scarring. So when you have scars in the tissues, in the fallopian tube, in the line of the fallopian tube, it can obstruct the movement of that egg down to the uterus where it's supposed to go. Yes. So another is people who conceived while having IUD in place. Yes, they are also at risk of having this ectopic pregnancy. People with infertility issues, people who have had surgery in the fallopian tube before are at risk of this ectopic pregnancy. So how can you avoid this ectopic pregnancy? There's no how you can avoid ectopic pregnancy. You can only reduce your risk of having it. Yeah, so by treating STDs, if you have sexually transmitted disease, endometriosis, you treat it. That's just the way to avoid it. So you cannot say if you take this one, you do this one, you avoid it. But there is this remarkable symptom I'll tell you before you even go to hospital to suspect ectopic pregnancy. Yes, when you have confirmed that you are pregnant, and you are having pain, lower abdominal pain, by the left or by the right of your lower abdomen, that is a very very as a sign that that pregnancy can be ectopic. Then you have to go to the hospital and confirm. Yes. It is the ultrasound that will now confirm it whether, because there are other conditions that can cause that. But this is a one number one remarkable sign that you experience in that first trimester that can be a sign of ectopic pregnancy. And another one is vaginal bleeding. So if you have any question on this ectopic pregnancy, do well to drop your question in the comment section. Thank you.